Question 1. The nurse assisted with the birth of a newborn. Which nursing action is most effective in preventing heat loss by evaporation? 1. Warming the crib pad. 2. Closing the doors to the room. 3. Drying the infant with a warm blanket. 4. Turning on the overhead radiant warmer. Explanation. Question 1. Rationale. Evaporation of moisture from a wet body dissipates heat along with the moisture. Keeping the newborn dry by drying the wet newborn at birth prevents hypothermia via evaporation. Hypothermia caused by conduction occurs when the newborn is on a cold surface, such as a cold pad or mattress, and heat from the newborn's body is transferred to the colder object, direct contact. Warming the crib pad assists in preventing hypothermia by conduction. Convection occurs as air moves across the newborn's skin from an open door, and heat is transferred to the air. Radiation occurs when heat from the newborn radiates to a colder surface, in direct contact. Test-taking strategy. Note the strategic words, most effective. Recalling that evaporation of moisture from a wet body dissipates heat along with the moisture will assist in directing you to the correct option. Question 2. The parent of a newborn calls the clinic and reports that when cleaning the umbilical cord, it was noted that the cord was moist and that discharge was present. What is the most appropriate nursing instruction for this parent? 1. Bring the infant to the clinic. 2. This is a normal occurrence and no further action is needed. 3. Increase the number of times that the cord is cleaned per day. 4. Monitor the cord for another 24 to 48 hours, and call the clinic if the discharge continues. Explanation. Question 2. Rationale. Signs of umbilical cord infection are moistness, oozing, discharge, and a reddened base around the cord. If signs of infection occur, the client needs to be instructed to notify the primary health care provider, PHCP. If these symptoms occur, antibiotics may be necessary. Options 2, 3, and 4 are not the most appropriate nursing interventions for an umbilical cord infection as described in the question. Test-taking strategy. Note the strategic words, most appropriate. Focus on the clinical manifestations provided in the question to assist in answering. Noting the word discharge in the question will assist in directing you to the option that indicates that the newborn needs to be seen by the PHCP. Question 3. The nurse in a neonatal intensive care unit, NICU, receives a telephone call to prepare for the admission of a newborn with APGAR scores of 1 and 4, born at 41 weeks gestation. In planning for admission of this newborn, what is the nurse's highest priority? 1. Turn on the apnea and cardiorespiratory monitors. 2. Connect the resuscitation bag to the oxygen outlet. 3. Set up the intravenous line with 5% dextrose in water. 4. Set the radiant warmer control temperature at 36.5 degrees Celsius 97.6 degrees Fahrenheit. Explanation. Question 3. Rationale. The highest priority on admission to the nursery for a newborn with a low APGAR score is the airway, which would involve preparing respiratory resuscitation equipment and oxygen. The remaining options are also important, although they are of lower priority. The newborn would be placed on an apnea and cardiorespiratory monitor. Setting up an intravenous line with 5% dextrose in water would provide circulatory support. The radiant warmer would provide an external heat source, which is necessary to prevent further respiratory distress. Test-taking strategy. Note the strategic words, highest priority. This question asks you to prioritize care on the basis of information about a newborn's condition. Although all options are correct, use the ABCs: airway, breathing, and circulation. A method of planning for airway support is to have the resuscitation bag connected to an oxygen source. Question 4. The nurse is assessing a newborn after circumcision and notes that the circumcised area is red with a small amount of bloody drainage. Which nursing action is most appropriate? 1. Apply gentle pressure. 2. Reinforce the dressing. 3. Document the findings. 4. Contact the primary healthcare provider, PHCP. Explanation. Question 4. Rationale. The penis is normally red during the healing process after circumcision. A yellow exudate may be noted in 24 hours, and this is part of normal healing. The nurse would expect that the area would be red with a small amount of bloody drainage. Only if the bleeding were excessive would the nurse apply gentle pressure with a sterile gauze. If bleeding cannot be controlled, the blood vessel may need to be ligated, and the nurse would notify the PHCP. Because the findings identified in the question are normal, the nurse would document the assessment findings. Test-taking strategy. Note the strategic words, most appropriate, and focus on the assessment findings in the question. This will assist in directing you to the correct option, because this is a normal occurrence after circumcision. Question 5. The nurse in a newborn nursery is monitoring a preterm newborn for respiratory distress syndrome. Which assessment findings would alert the nurse to the possibility of this syndrome? Select all that apply. 1. Cyanosis. 2. Tachypnea. 3. Hypotension. 4. Retractions. 5. Audible grunts. 6. Presence of a barrel chest. Explanation. Question 5. Rationale. A newborn infant with respiratory distress syndrome may present with clinical signs of cyanosis, tachypnea or apnea, nasal flaring, chest wall retractions, or audible grunts. Hypotension and a barrel chest are not clinical manifestations associated with respiratory distress syndrome. Test-taking strategy. Focus on the subject, signs of respiratory distress syndrome. Eliminate hypotension, as this is not a finding associated with respiratory distress syndrome. Also, respiratory distress syndrome is an acute occurrence, and a barrel chest develops with a chronic condition. In addition, note the relationship between the diagnosis and the signs noted in the correct options. Question 6. The postpartum nurse is providing instructions to the parent of a newborn with hyperbilirubinemia who is being breast/chest fed. The nurse would provide which instruction to the parent? 1. Feed the newborn less frequently. 2. Continue to breast/chest feed every 2 to 4 hours. 3. Switch to bottle feeding the infant for 2 weeks. 4. Stop breast/chest feeding and switch to bottle feeding permanently. Explanation question 6. Rationale: hyperbilirubinemia is an elevated serum bilirubin level. At any serum bilirubin level, the appearance of jaundice during the first day of life indicates a pathological process. Early and frequent feeding hastens the excretion of bilirubin. Breast/chest feeding needs to be initiated within 2 hours after birth and every 2 to 4 hours thereafter. The infant should not be fed less frequently. Switching to bottle feeding for 2 weeks or stopping breast/chest feeding permanently is unnecessary. Test-taking strategy: eliminate options 3 and 4 because they are comparable or alike. These options discourage the continuation of breast/chest feeding and should be eliminated. From the remaining options, recalling the pathophysiology associated with hyperbilirubinemia will assist you in eliminating option 1. Question 7. The nurse is assessing a newborn who was born to a birthing parent who is addicted to drugs. Which findings would the nurse expect to note during the assessment of this newborn? Select all that apply. 1. Lethargy. 2. Sleepiness. 3. Irritability. 4. Constant crying. 5. Difficult to comfort. 6. Cuddles when being held. Explanation question 7. Rationale: a newborn of a birthing parent who uses drugs is irritable. The infant is overloaded easily by sensory stimulation. The infant may cry incessantly and be difficult to console. The infant would hyperextend and posture rather than cuddle when being held. This infant is not lethargic or sleepy. Test-taking strategy: lethargy and sleepiness are comparable or alike in that they indicate hypoactivity of the newborn. Therefore, these options can be eliminated. From the remaining options, recalling the pathophysiology associated with an infant born to a drug-addicted parent and that such an infant is irritable will assist you in eliminating option 6, that this infant will cuddle when being held. Question 8. The nurse notes hypotonia, irritability, and a poor sucking re-rex in a full-term newborn on admission to the nursery. The nurse suspects fetal alcohol syndrome and is aware that which additional sign would be consistent with this syndrome? 1. Length of 19 inches. 2. Abnormal palmar creases. 3. Birth weight of 6 pounds, 14 ounces, 3,120 g. 4. Head circumference appropriate for gestational age. Explanation question 8. Rationale: fetal alcohol syndrome, a diagnostic category of fetal alcohol spectrum disorders, FASDs, is caused by birthing parent alcohol use during pregnancy. Features of newborns diagnosed with fetal alcohol syndrome include craniofacial abnormalities, intrauterine growth restriction, cardiac abnormalities, abnormal palmar creases, and respiratory distress. Options 1, 3, and 4 are normal assessment findings in the full-term newborn infant. Test-taking strategy: Use knowledge regarding normal assessment findings in the full-term newborn infant to answer this question. Length, birth weight, and head circumference are comparable or alike in that all are physical measurements assessed on a newborn and represent normal findings in a full-term newborn. The nurse is creating a plan of care for a newborn diagnosed with fetal alcohol syndrome. The nurse would include which priority intervention in the plan of care? 1. Allow the newborn to establish own sleep-rest pattern. 2. Maintain the newborn in a brightly lighted area of the nursery. 3. Encourage frequent handling of the newborn by staff and parents. 4. Monitor the newborn's response to feedings and weight gain pattern. Explanation question 9. Rationale: fetal alcohol syndrome, a diagnostic category delineated under fetal alcohol spectrum disorders, FASDs, is caused by birthing parent alcohol use during pregnancy. A primary nursing goal for the newborn diagnosed with fetal alcohol syndrome is to establish nutritional balance after birth. These newborns may exhibit hyperirritability, vomiting, diarrhea, or an uncoordinated sucking and swallowing ability. A quiet environment with minimal stimuli and handling would help establish appropriate sleep-rest cycles in the newborn as well. Options 1, 2, and 3 are inappropriate interventions. Test-taking strategy: note the strategic word, priority. Think about the pathophysiology that occurs in a newborn with this condition. Also, use Maslow's hierarchy of needs theory to direct you to the correct option. Remember that nutrition is a priority. The nurse administers erythromycin ointment, 0.5%, to the eyes of a newborn, and the birthing parent asks the nurse why this is performed. Which explanation is best for the nurse to provide about neonatal eye prophylaxis? 1. Protects the newborn's eyes from possible infections acquired while hospitalized. 2. Prevents cataracts in the newborn born to a parent who is susceptible to rubella. 3. Minimizes the spread of microorganisms to the newborn from invasive procedures during labor. 4. Prevents an infection called ophthalmia neonatorum from occurring after birth in a newborn born to a parent with an untreated gonococcal infection. Explanation question 10. Rationale: erythromycin ophthalmic ointment 0.5% is used as a prophylactic treatment for ophthalmia neonatorum, which is caused by the bacterium Neisseria gonorrhoeae. Preventive treatment of gonorrhea is required by law. Options 1, 2, and 3 are not the purposes for administering this medication to a newborn infant. Test-taking strategy: note the strategic word, best. Use knowledge of the purpose of administering erythromycin ophthalmic ointment to a newborn infant. Remember that this is done to prevent ophthalmia neonatorum. Question 11. The nurse is preparing to care for a newborn receiving phototherapy. Which interventions would be included in the plan of care? Select all that apply. 1. Avoid stimulation. 2. Decrease fluid intake. 3. Expose all of the newborn's skin. 4. Monitor skin temperature closely. 5. Reposition the newborn every 2 hours. 6. Cover the newborn's eyes with eye shields or patches. Explanation for question 11. Rationale. Phototherapy uses intense light to lower bilirubin in newborns. Key risks include eye injury, dehydration, and sensory deprivation. The infant's skin is mostly exposed, but the genitals stay covered. Eyes are protected with shields, which are removed once per shift to check for irritation and allow brief eye contact. The nurse checks lamp output with a photometer, monitors temperature, and increases fluids. Green stools and urine are expected. Skin color is assessed with lights off every 4 to 8 hours, watching for bronze baby syndrome. The infant is repositioned every 2 hours and stimulated. After therapy, monitor for rebound hyperbilirubinemia. Test-taking strategy. Focus on preventing eye damage, dehydration, and sensory deprivation. These guide the correct interventions. Question 12. The nurse creates a plan of care for a birthing parent with human immunodeficiency virus, HIV, infection, and the newborn. The nurse would include which intervention in the plan of care? 1. Monitoring the newborn's vital signs routinely. 2. Maintaining standard precautions at all times while caring for the newborn. 3. Initiating referral to evaluate for blindness, deafness, learning problems, or behavioral problems. 4. Instructing the breastfeeding/chest feeding parent regarding the treatment of the nipples with Nystatin ointment. Explanation question 12. Rationale. An infant born to a birthing parent infected with HIV must be cared for with strict attention to standard precautions. This prevents the transmission of HIV from the newborn, if infected, to others and prevents transmission of other infectious agents to the possibly immunocompromised newborn. Options 1 and 3 are not associated specifically with the care of a potentially HIV-infected newborn. Parents infected with HIV should not feed their newborn human milk. Test-taking strategy. Eliminate options 1 and 3 first because they are comparable or alike and are not associated specifically with the care of a potentially HIV-infected newborn. Recalling that HIV-infected parents should not feed human milk will direct you to the correct option. Question 13. The nurse is planning care for the newborn of a birthing parent with diabetes mellitus. What is the priority nursing consideration for this newborn? 1. Developmental delays because of excessive size. 2. Maintaining safety because of low blood glucose levels. 3. Choking because of impaired suck and swallow reflexes. 4. Elevated body temperature because of excess fat and glycogen. Explanation question 13. Rationale. The newborn of a diabetic birthing parent is at risk for hypoglycemia, so maintaining safety because of low blood glucose levels would be a priority. The newborn would also be at risk for hyperbilirubinemia, respiratory distress, hypocalcemia, and congenital anomalies. Developmental delays, choking, and an elevated body temperature are not expected problems. Test-taking strategy. Note the strategic word, priority. Read each option thoroughly and eliminate options 1, 3, and 4 because they are comparable or alike in that newborns of diabetic birthing parents are not at risk for these problems. Also, Also, note the relationship between the words diabetes mellitus in the question and the word glucose in the correct option. Question 14. Which statement redirects a new birthing parent's understanding of the teaching about the prevention of newborn abduction? 1. I will place my baby's crib close to the door. 2. Some healthcare personnel won't have name badges. 3. It's okay to allow the nurse assistant to carry my newborn to the nursery. 4. I will ask the nurse to attend to my infant if I am napping and my partner is not here. Explanation. Question 14. Rationale. Precautions to prevent infant abduction include placing a newborn's crib away from the door, transporting a newborn only in the crib and never carrying the newborn, expecting healthcare personnel to wear identification that is easily visible at all times, and asking the nurse to attend to the newborn if the parent is napping and no family member is available to watch the newborn. The newborn is never left unattended. If the parent states that the nurse will be asked to watch the newborn while sleeping, this indicates an understanding of the teaching. Options 1, 2, and 3 are incorrect and indicate that the parent needs further teaching. Test-taking strategy. Focus on the subject, that the client understands precautions to prevent infant abduction. Read each option carefully, and select the option that provides protection to the infant. This will direct you to the correct option. Question 15. The nurse prepares to administer a phytonadione, vitamin K, injection to a newborn, and the parent asks the nurse why the infant needs the injection. What best response would the nurse provide? 1. Your newborn needs the medicine to develop immunity. 2. The medicine will protect your newborn from being jaundiced. 3. Newborns have sterile bowels, and the medicine promotes the growth of bacteria in the bowel. 4. Newborns are deficient in vitamin K, and this injection prevents your newborn from bleeding. Explanation for question 15. Vitamin K, phytonadione, is given to newborns to prevent bleeding by helping the liver make clotting factors 2, 7, 9, and X. Newborns are deficient because their intestines lack the bacteria needed to produce vitamin K until feeding begins. Vitamin K does not affect immunity or jaundice. Test-taking strategy. Note the strategic word, best. Because immunity and jaundice are not related to the action of vitamin K, eliminate options 1 and 2. From the remaining options, recall the action of vitamin K to direct you to the correct option. Remember that vitamin K does not promote the growth of bacteria but is administered to prevent bleeding.